it's Dr. Sammy Pryor, and today we're going to talk about breast cancer, and I'm wearing my pink, and it even has a ribbon. I got this free an apartment, Stuytown in New York City, where my best friend lives right now. There were these bags of clothes, and this was in it. Woohoo! Free clothes! And because I fled an abusive spouse and I am starting all over, I had to leave everything I've ever owned. So when I get a score like this, I know God is doing it for me. So today we're going to talk about breast cancer. And the breast cancer, there's a lot of people that are going to experience it, mostly women, but there are men who get breast cancer as well. It is a tissue, and tissues can get cancer, any tissues in the body. But it is one of the most common cancers in women. Right now, 1 in 5 women will experience breast cancer in their lifetime, but it is rising, and they think by 2030 it could be 1 in 3 women. 1 in 3 women. That's 33% of the population in the United States. Blows your mind, doesn't it? But it has to do with environmental toxins and the microbiome. And there's an awesome study that's coming out from Europe where they're studying these environmental toxins they call xenobiotics. I don't know why I just had like that blip where your brain kind of goes woo offline for a second, but xenobiotics, they mimic estrogen in the body. And you'll learn more about this as the video goes on, okay? But they play a role with the microbiome, so they're studying it. They're studying how the microbiome interplays with the xenobiotics to increase your risk for breast cancer. That is a fantastic study. The results are not out, but there have been other studies on the microbiome in breast cancer, so that's what we're going to talk about today. And this is for all women, since everyone is at risk for breast cancer. It's that prevalent. Okay? And men, it won't hurt you either to listen to this because men can get breast cancer as well. Oh, I know that's rough. I hate to break that news, yeah. But they took women that didn't have breast cancer and they took women that had breast cancer, and they wanted to look at the microbiome in the breast. And breast used to be thought of as sterile. That's been debunked. We know that women, when they breastfeed, bacteria leave the breast milk and go for the baby to populate the gut. And that is so fascinating. That's pretty new research. But there is a microbiome inside the breast tissue. So they wanted to look at that. And so they did. And what they found was the microbiome was completely different in the women without cancer and the women with cancer. And these tumors and the local area around the tumors had, I wrote the statistic down, up to 50% of these breast tumors were positive for Epstein-Barr virus. And Epstein-Barr virus is also called EBV, and it is the causative agent for mono. Many of you might have had mono. I had it. It kicked my butt. For like 6 months, I was asleep. Yeah, it's just tired. But many of you will never get the classic symptoms of mono, but you will pick up Epstein-Barr virus because 98% of people, by the time they die, have the antigen in their body, meaning they got Epstein-Barr virus along in their lifetime. And what this virus does, it incorporates itself into the DNA, and it'll stay dormant until your immune system goes down, and then it will reactivate, okay? So having a healthy immune system, super important. But these tumors were up to 50% had Epstein-Barr virus, and another high prevalence was HPV or human papillomavirus, and this virus causes throat cancers, vaginal cancers, cervical cancers, and rectum cancers in men and women. Yeah, so HPV, EBV, very common to cause breast cancer. Okay, and that was found in this study. Another study, they looked at the gut microbiome and how it influenced the breast cancer. And yes, there was very difference in breast cancer and women without breast cancer. And they were looking at the diversity and the composition of the gut flora. And they found that the gut flora had more of these microbes that metabolize estrogens. Okay, I'm gonna break something down more simple. It's very complicated, but basically your liver, it processes excess estrogens and xenobiotics, and it plugs this thing called glucuronic acid on it to put it in the stool to pass it. Okay, and you have these bugs in the gut. Some are commensals, meaning that they just live there, they're not harmful, but some are actually pathogenic that make an enzyme called Beta-glucuronidase, and this cleaves or takes off the glucuronic acid, and that allows the estrogens to recirculate and the xenobiotics, which are toxins, remember, in the body and mimic estrogen. And this causes an excess estrogen load and really increases your risk for breast cancer and uterine cancers, which are on the rise. Okay, so yes, they found more of these beta-glucuronidase making bacteria in the gut. Okay, and another study found, they were looking at specific bacteria, and they found a reduced abundance of methylobacterium in breast cancer patients, and this was correlated with tumors of greater invasive potential. Scary stuff. Okay, so breast cancer can spread. You don't want it to spread. I had a patient in her 40s when I was in school and clinic. She had breast cancer that spread to her bones, and it spread all over her body, and she was dying, and she had a very small child. So you want to lower the risk for invasive potential and the risk for breast cancer, and you need this bug called methylobacterium. And I have been talking in this series about a link, an affiliate link. I'll get just a small portion of it to go to the site and get a test. It's a stool test, and it will tell you different bacteria you have in your gut. I'll show you my results. Okay, first you will buy a kit and you'll plug in the activation code at the website. Then you will make an account, and once the time lot, you will go sign in and you'll land on this page. Then you'll click the gut health and it'll send you over to this page, and it'll give you your gut a score. As you see, mine's pretty good, but I didn't start that way. I'll tell you about how I got my score up to that one day. But then you will click on the bacteria levels. It'll send you to this page, and then you'll see the download the CSV. Click that and it will download a Excel spreadsheet in your downloads. You'll open that up, and what you'll see is a list of bacteria, and you'll hit Control Find, and in that Control Find you'll type in Methylobact, B-A-C-T. And the reason is because they don't have the methylobacterium, but they have the family that it belongs in that I found, Methylobacteriaceae. And when I did this, I found 2 in my stool. And basically what you'll do is you'll follow the prebiotics, and you'll increase the prebiotics, especially the ones they recommend you. And you will eat that way for 3 to 6 months, and then you'll retest and see if these levels have increased. And that's what you do. And back to the video. Yes. So we're going to talk about this, how to help these things, okay? First, like I said, the immune system, you need to keep up, okay? If you're getting a lot of colds and things like that, you need to come to a naturopath like myself, or you can reach out, make an appointment. We can do things to increase your immunity. Second thing, you need to make the bacteria more diverse in the gut. This will lower the amount of these certain bacteria that cleave the glucuronic acid with beta-glucuronidase, okay? And the way you do that is by having more prebiotics. So you need to go watch the video on prebiotics. And then lastly, you need to check out for the methylobacterium. It's called Methylobacteriaceae, okay? And in that link, I'll put it in there. Go get this test, especially if you have breast cancer, especially if you have BRCA1 or BRCA2 and you're at an elevated risk for breast cancer. Yeah, this bacteria is super important for you guys. So that's all we're talking about. We need to eliminate breast cancer. It's going to be hard because of these xenobiotics, but we can do things with our diet. We can do things to lower our risk, okay? I love you guys, and that's all this video is about. Please give me a thumbs up. I am trying to help people, and that will encourage me that I'm actually helping people if you give me a thumbs up. And please subscribe. I make health topics that can change your life. I'm a naturopathic doctor, so I investigate the cause of diseases. When you go to other health practitioners that are not NDs, they give you things to cover symptoms. That's not what we can do that. And yes, like pain, we want to not want you to feel pain, but eventually we're going to get to the root cause and help you lose that, okay? But yeah, so please subscribe, support my mission in life, and I love you guys, and have a good rest of your day. Bye.